Hi, it's Bill, the Knee Pain Guru. And here's how the Quit Your Quack program can help if you've had a diagnosis of arthritis. First and foremost, we have to understand what is going on in the knee with arthritis. And all diagnosis of arthritis, there is a component of it. You can look on your doctor's diagnosis that says the joint is dehydrated. So conventional thinking is drink water, the joint will get rehydrated. But there's layers of stuff in order to get the joint rehydrated. The thinking is, drink more water, we'll get injections in the joint, we'll take prescription drugs or some other thing to numb the pain, so then it'll help what's going on. But what's happening is there is a systemic issue going on with the knee joint that is preventing the joint from rehydrating itself. So first thing, drinking more water is actually beneficial. However, what is happening in the joint when the joint is dehydrating is it's squeezing tight. So when it squeezes tight, it squeezes out the synovial fluid in the joint, which is exactly what the injections are trying to get back in the joint. When the joint gets dehydrated, think of the sponge next to your sink that hasn't been underneath the water in a few days. It gets dry and stiff and brittle, which contributes to the joint wearing, the pain that you're feeling, and the joint to tense up more. What ends up happening is that causes a condition where the joint begins to rub and cause you more pain. With the Quit Your Quack program, what we will do first and foremost is begin to create comfort in the knee by getting the pressure off of the nerves. Once we get the pressure off of the nerves, the joint begins to relax. Now that the water that you are drinking has the space to be able to get inside the joint. So that's going to start this cascade effect of you focusing more on comfort rather than on pain. Now, there's another factor that goes into it. Your body may not be able to absorb the water that you're drinking. This is a whole nother issue that we would need to look at and evaluate to make sure, and good indication is you drink water and you run into the bathroom 5 minutes later, that's not effective. If you're drinking plenty of water, the joint has become relaxed and there's space in the joint now that you're drinking water and the body's not actually absorbing the water that you're drinking. So we have to look at the mineral balance in your body to make sure that the body is able to absorb the water that it's drinking. And when it absorbs the water that it's drinking, it's able to get inside the joint to flush out the joint and then make sure we're setting up the conditions so the pressure is off the nerves on a consistent and regular basis, while looking at other factors such as nutrition and breathing and supplementation, as well as your mindset, because there's a good chance that self-sabotage could play a role in this, that the minute you get out of pain, you want to jump right back into your normal life or the life that you would like to be living too fast, throwing the body back into pain. So we're going to systematically go through your knee first, setting up the conditions in your body and making sure your head's in a good place so we're not sabotaging the process that we're making, the advancements we're making, getting your knee and your body to feel more comfortable. So that's how the Quit Your Quack program can help you if you've had a diagnosis of arthritis in your knee. Thank you so much. This is Bill Paravano, the Knee Pain Guru, and looking forward to seeing you in the program.